You're welcome back. This is Breakfast Daily, and we are moving to the Ashanti region. You know, there's been increase in maternal mortality cases, and we really want to understand what exactly is going on because, David, by now we would have expected, very low numbers, and we're doing so well. But it looks like now we are having, increases in these kind of cases. What exactly is happening? Let's watch this report. When we come back, we'll try to get deeper understanding into what exactly is happening. Just take a look.
Eclampsia and postpartum hemorrhage have been identified as major causes of maternal deaths in the Ashanti region. Figures from the Ashanti Regional Health Directorate show a marginal increase in maternal mortality rates from 132 to 134. Ashanti Regional Health Director Dr. Emmanuel Tinkran gave a further breakdown.
Maternal mortality still remains a major challenge in the region. During the year under review, our maternal mortality rate increased marginally from 132 per 100,000 live births to 134 per 100,000 live births. The total number of maternal deaths recorded in the region was 181. The major cause of maternal death remained eclampsia and postpartum hemorrhage, whilst the percentage of maternal death audited was 100%.
Dr. Tinkran, speaking at the annual health performance review in Kumasi, raised issues about audits the directorate is facing.
Audit issues still remain a major challenge in the region. Common audit observations include misapplication of IGF, falsification of records to conceal fraud, direct spending of cash on retirement pay vouchers, misapplication of drug funds, spending outside the approved budget without approval, and unearned salaries. It is expected that the management of the facilities will be vigilant to avoid these common audit observations, to avoid appearance at the Public Accounts Committee of Parliament.
Director General of the Ghana Health Service, Dr. Patrick Kumabwaji, called for systems to be strengthened to address maternal deaths.
Our performance review has been very significant. I'm talking more about the national level performance. We have decreases in our institutional infant mortality rates across as a nation. Our neonatal mortality rate is down, and so is under 5 mortality rates. These are good when they are down, especially for those who may not understand. Similarly, the institutional maternal mortality decreased from 111 to 102 per 100,000 live births, reducing, and I believe that is probably one of the lowest we've ever recorded since we started reporting institutional maternal mortality ratios. The number of total deaths reduced from 875 to 809. And remember, Ashanti alone contributed 181. So it means that there's more work to be done. If you did 90, we'll be doing much better. So a lot of work is
The event on the theme addressing the challenges of non-communicable diseases through awareness creation and capacity building brought together key staff members of the Ghana Health Service.
Right, so you heard the report filed by our Ashanti regional correspondent, Hafiz Tijani. Now, David, this is an issue.
It is an issue. It's a very big issue. And I think that we shouldn't attempt to paint a glossy picture.
Yeah.
You know, the reality is that there are issues, right? And so as much as there are issues, we need to make sure that we deal with the factors, you know, the various issues that would cause maternal mortality rates in different places to go in, different sectors to go up. We need to deal with those things, right? Because at the end of the day, nobody wants a case where you have a health system where mothers are going to hospital, they don't know whether they'll return.
Exactly.
Nobody wants this.
Yeah.
Do you see?
Yeah.
And so we need to resolve whatever it is. What first of all, what are the causes?
Yeah.
I mean, we'll talk about eclampsia as one of the incidents.
And
now,
postpartum.
Yes, you know, what's causing
Why
that?
is that
What's
so?
triggering
Exactly.
this? Why are women experiencing eclampsia? You know, and of course, the factors for eclampsia are a little bit amorphous at the moment. The doctors even are not really sure, but there's brain and nervous system issues,
Exactly.
challenges, blood vessel issues, you know, there as
Pressure,
well.
convulsion
But we
stuff,
need,
yeah.
yes, exactly. But we need to understand what it is that's making this the incidence of eclampsia increase.
Because really, that is
and
why
then
they come for
fix it.
antenatal.
Yes.
You know, so if we are coming in for antenatal and still we are recording some of these issues, you know, we are coming in for
what's being
postnatal
done at the
and we are
antenatal
still
level? Yes.
recording high numbers due to postpartum
Yeah.
issues and all
Yeah.
that, then we really need to launch a proper investigations into
Yeah.
this, you
Yeah.
know, to understand what exactly is causing
because if you're
this.
attending antenatals and it's not impacting positively on the maternal death
Yeah.
rate, there's an issue.
Could it be something we are not doing right?
Yeah.
Wrong administering of drugs and all that? What exactly? Or they don't even have what they need at all.
Yeah,
You
yeah,
know, so
yeah.
we really need to understand this, because places like Ashanti region shouldn't be recording such high numbers.
No.
You know, we spoke about infant mortality rates not long ago up north, and now we are in the Ashanti region. What we don't want, you know, is issues on stuff like that,
Yeah.
you know, issues with, I mean, our health system in general really needs serious attention.
Yeah.
And now it's beginning to have a telling effect on how we do our stuff, you know.
We've been joined on the line by our Ashanti Regional correspondent, Hafiz Tijani. Hafiz, good morning.
Good morning, Dave. Thank you. Yeah, I can hear you, Dave. Yeah, Dave, I can hear you clearly. Yeah, Dave, I can hear you clearly from Kumasi. Yes, I can hear David.
So, a little bit more perspective on the report that what seems to be the doctors and the health care providers' position on the causes of maternal death increase in the Ashanti region?
Well, so the health director, Dr. Emmanuel Tinkran, expressed this concern when he met the health workers at that meeting, and he says that his first statement, or his opening statement, was that maternal mortality remains a major challenge in the Ashanti region. So if you say remains, it means that this is something, or a challenge, a healthcare challenge, health authorities in the region are dealing with. Remember, some time ago, there were rising cases of maternal mortality at the Konfo-Anokye Teaching Hospital, which there was this advocacy by the media and other stakeholders in the health sector to get the government to step in and build the maternal and children block or mother and baby units at the hospital. So a lot of health workers are saying that the Konfo-Anokye Teaching Hospital, because it's a referral center and it's serving places or communities within the Ashanti region and outside of the Ashanti region. So the numbers coming in could partly lead to the increase of these cases in the region when some of these figures are being put together. But the major causes for the health workers or the regional health directorate is the eclampsia and the postpartum hemorrhage. And he is concerned about this. He tasked the health workers especially in rural communities within the Ashanti region, to step up their game to try and look at the major causes. What is the causal effect of some of these issues that are coming up, so that they can manage these cases before even the cases get into other health facilities which are serving as referral facilities within the region. And the same points that the Director General of the Ghana Health Service also made. He says the figure is alarming. 875 cases nationwide, and Ashanti region is recording 22% of this figure, which means the health systems must be strengthened. Health authorities or the health workers must sit up and look at the causes of some of these things, whether it's lifestyle, whether it's education that is not going down well with the pregnant women or some of these patients and victims, whether it's something that is missing within the health system or the health delivery system. So much needs to be done to be able to curtail some of these things. And this is a worry for the health directorate in the Ashanti region.
Now, Hafiz, are you able to give us the trends, over the years, how the records have been, just so we can put this in perspective properly?
Well, for health workers, from 2020 to 2022, the figure has not been improving. You don't have the statistics going down like they want it to go. They are recording more deaths. In 2021, for instance, in 2020, for instance, the health workers said the figures increased. The figures should be coming down because of what they are doing. They are trying to educate the pregnant mothers when they come for antenatal. They are trying to advise them how their dieting will be, what they need to do when they are pregnant, what they need to do when they are going into labor, and what health authorities or the health officials at the various health facilities need to do when they go into labor with these pregnant women. And they are saying that the figure is not, the picture is not so good as they want it to look like. So more needs to be done, and it's not so encouraging.
Right. Now, are you able to give us specifics, in terms of areas where we are recording high numbers in the Ashanti region? So, for instance, is it the Kumasi Metro leading? Is it, let's say, Kwadaso? Is it Amansie? Are you able to give us, breakdown of the areas?
Well, for health authorities, it's, the areas, like I said, most of these areas you mentioned, like Amansie and other rural communities, the health system there is not so good as compared to the urban centers like the Kumasi or the capital or the general Kumasi area. So the Kofanochi Teaching Hospital is a major referral hospital, and the Menshia Hospital also is a referral facility for the smaller health facilities within the region. So if cases are brought in from the districts to these referral facilities, numbers that are being recorded are going to be taken from these facilities, because they are not going to be taking the numbers from these facilities that are coming. That was not where the deaths occurred. So numbers about the deaths are going to be taken from these referral facilities to make some of these projections and put together these figures. So health authorities were not able to give specifics as to where these deaths were.
Now, we also had the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje, speaking. Did he mention, what is going to be done nationally to address maternal deaths, and in particular the Ashanti region?
Well, for him, a lot is being done. Even with the health director, he says that they stalled health facilities. He mentioned Kumewu, he mentioned Sewa, which is supposed to be the regional hospital for the region. He also mentioned the Aferi Military Hospital. All these projects, they have not been able to meet their completion deadlines. And he says that when these facilities come up, it means that the burden is going to be reduced on referral facilities like the Kofa Teaching Hospital, and the burden is also going to be reduced on a facility like the Menshia Hospital, where a lot of people go to seek medical care. So if you have Formina Hospital operating, if you have the Aferi Military Hospital operating, that is going to take care of even people coming from Tepa, Bibieni, and some areas like Mankranso and all that. And if you have the Sewa Hospital operating, which is the regional hospital for the Ashanti region, is going to take care of those who are coming from Busunchi area and other areas within the region. So the burden on the health facilities, which are major referral facilities, are going to come down, meaning that more efforts is going to be put in place by the health workers to be able to tackle some of these challenges. But the Director General of the Ghana Health Service, he was emphasizing on how the health workers themselves can put measures in place in terms of stepping up their game to try and then bring down some of these issues. He was equally worried about the figure recorded in the Ashanti region for the year under review.
Thank you very much, Hafiz.
Thank you.
Right,
friends.
so we've been speaking with our Ashanti Regional correspondent, Hafiz Tijani, who joined us from our Ashanti Regional studios that is in Kumasi. So that was Citi TV studios in Kumasi.
Yeah. Yeah, so I mean, I think that this is something that we definitely need to jump on top of really hard and fast.
Yeah.
Because we cannot have, the numbers going up. In the worst case scenario, don't stay the same level,
Yeah,
but don't be
grow.
climbing up at
And
this
I,
point in
I, I
time.
think that what the regional health director mentioned is very key. If the hospitals, are equipped, then we don't need a lot of people coming to the Confanoche or the Mensha referral hospital, you know, because it also puts pressure on these facilities and really how much can they do, you know. So I think the most important thing is let's make sure that basic needs to help pregnant women are available at the other hospitals, you know, district hospitals and other such facilities, even clinics, you know, because really if pregnant women are coming in for antenatal, they don't really need so much. You know, just basics, and well, there are those whose pregnancy would require much attention, but generally, pregnancy is not sickness.
It's not a disease, no.
You know,
It's
so
not.
if you're pregnant, you're not sick. So really, if people are being taken good care of, they shouldn't just die. You know, because if you're monitoring staff, if they are coming in, making sure you check pregnant women, check babies in there as well. These things should be. I mean, easily handled, you know, and I think that's very unfortunate that for whatever reason, a pregnant woman would just die.
The top four causes of maternal death, you're talking about complications from birth, you're talking about eclampsia, pre-eclampsia. So these two are things that are more medical and attention needs to be paid to at the facility. But the others, you're talking about infections after birth, you're talking about a severe loss of blood after birth. So those others, very good advice, following the protocols, those kinds of things that you're given, usually should fix the problem.
Exactly, and that is where Dr. Kumar Bwaje's, admonition to health workers come in, because some of these things, like you mentioned, advice and proper practice, what to do, what not to do, and these are some of the things that are taught, when you attend antenatal classes and all that. And so I think it's also very important equipping pregnant women to know their do's and don'ts, what they have to do. Look, some people get pregnant and they take all kinds of medication, which they are not supposed to. Do people know what they have to take, what they can't take? If I'm pregnant and I have malaria, what do I have to do? If I'm pregnant and I have a headache, what do I have to do? So I agree with Dr. Kumar-Boadjeh on the need for health workers to also up their game to equip these women to deal with some basics, during pregnancy.
Yeah. Well, the Director General of the Ghana Health Service has joined us on the line, Dr. Patrick Kumar-Boadjeh. Doc, good morning. Dr. Kumar-Boadjeh. Hello, Doc.
Hello.
Hello, good morning.
Good morning.
Yes, Dr. Kumar-Boadjeh, good morning and welcome to Breakfast Daily.
Thank you.
Yes, so we're looking at the situation in Kumasi, the Ashanti region in general, and the rise in maternal death cases. Let's look at what the possible solutions are. We know that there's so many angles to this. There's the safe practices by the mothers themselves. There's the hospital care and so on and so forth. For you, in terms of low-hanging fruits, what should mothers be doing? What should hospitals be doing to make sure that their numbers go down as soon as possible?
Yeah. Thank you very much, and thanks for the opportunity. I think there are two ways, as you had already alluded to. That is what we do in our facilities, and then what mothers do that leads to some of the deaths.
Yeah.
There are three key areas.
Okay.
I mean, it's an old system of the three delays where you delay in taking decision and deciding to move. Delay in getting to the facility, and the delays, and of course, some factors that are not probably most efficient that occurs in some facilities. So these are the things we are actually looking at. Ashanti, and I must say that in maternal mortality, it is designated in proportions because it's a risk-based measure. What we mean is that for a population of about 6 million, if you just compare numbers with numbers, then you're going to have a challenge.
Okay.
So I'm looking at the demand, the supply side. The key challenges are that a large number of these deaths occur in the highest referral hospital, which is Komfanochi, which receives cases not only from Ashanti, but from Western North, Ahafo, and part of Central Region.
Oh, okay.
And to the north. And so you have an aggregate of cases that may be overwhelming or they may reach very late. And so their conditions are such that it is difficult to service. And that's the more reason why people must refer early, people must come in early.
Yeah.
We've had situations the last survey with the people were leaving only about 29 minutes from the hospital so died because they didn't go on time, even though they were only 29 minutes from the nearest hospital that could have saved them. So the whole developmental and other things. So on the demand side is the fact that people's behavior, the way they eat, the way they take care of them during pregnancy, and unfortunately we have other intrusions of churches and other places that are also influencing patient behavior, which sometimes might lead to delay or getting inappropriate care. And you are asked that you need to have the cesarean section because the baby is too big, or you've had 2 cesarean sections, and the pastor tells you that he has prayed and everything will be fine. So these are some of the core challenges. So Komfanochi also received. So of the 181 deaths that occurred in the Ashanti region in 2022, it brings their risk to about 135 per 100,000 live births. but a large number, about 70% of all the deaths occurs comes from confirmatory.
Okay.
And then the rest comes from the 43 districts in the region. So there's a lot that we can do. What they need to do is to ensure that when we are able to restart the regional hospitals, when the After hospital, the military one, is also reopened in Ashanti region, that will also suggest and probably more people can be seen quickly and not overwhelm confirmatory.
Yeah.
If that's the situation. So those are some of the key challenges that we are having. So when you measure the risk, it's so high because they had the highest deaths.
Yeah.
And incidentally, for the whole country, of the 16 regions, so only 30 regions did worse than the previous year. And this is Ashanti, Savannah, and Eastern. Marginal increases in the deaths.
Okay. Okay. Yeah. So. Go ahead. Go ahead.
So those are the supply side issues that I believe that the way we organize the services will also improve to ensure that within Kumasi there are many hospitals where cases can be referred to their specialists there instead of everybody aggregating and confirming. It can be redistributed to the centrals and the Ministry where they all have obstetricians to be able to quickly intervene if that is there's a delay in acting.
Now, let me just ask, in terms of the Ghana Health Service, the rollout of your maternal programs, do you include the traditional birth attendants in terms of your trainings and all of that, considering that, what you refer to, people are coming from Western North and other places. I'm just thinking, if the traditional birth attendants were better equipped, maybe some of the challenges that happen from that end, could be solved, and maybe even if there are delays in getting to the referral centers, some of the challenges lower down the ladder could be helped. I don't know if that's a possibility.
Okay. Now, let me share the data with you. I think this TBA thing is an old story.
Okay.
That we continue to bring up. Since the 80s, we've been working with TBAs.
Okay.
Currently, the contribution of TBAs to delivery is less than 5%.
Okay.
Less than 5%.
Okay.
About 4% the last time I was checking, was a couple of years ago.
Okay.
So the number has significantly dwindled. So what we do is that there's enough care at the health center, at the state compound.
Okay.
And so where the policies are where you do not have the capability to support a community because of their distance, etc., then you train, and we continue to support some TBAs whose work is relevant to support. But their contribution is quite low.
Yeah.
So now what is happening is the behavior is really the behavior of the clients as to whether they come in early.
Yeah.
And of course, the activities and the rapid responses that they will also receive on arrival. Yeah, but I must say that over the years, maternal mortality has significantly reduced. And in 2021, we recorded the lowest national ratio. And we're still recording very, very low ratios. And if we had around the 2008, we were doing about 280 per 100,000 live births. Now we are doing about 1 to 1. Well, this year is about 112.
Okay.
100,000. So the national coverage improved.
Okay.
But we are always looking at the small areas. So we normally will send a team to Ashanti to do some diagnosis to see what we can do better. And anytime we make such intervention, we do that internally. Once those interventions are done, they are sustained, we see a decline in this, and that is on both on the demand side, that client behavior, community engagement, and also improvement in the working practices at the facilities, which, as I said, we will continue to look at. And anytime we see by half year, if sometimes your numbers are too high, a team is dispatched to come and assist you to see what is going on, how can we help you to improve.
All right. Thank you so much. We really appreciate your time this morning. We've been speaking with the Director General of the Ghana Health Service, Dr. Patrick Kuma Abuaje. Yeah, so I like the clarification he's brought to it, right? So we're looking at increasing numbers in Ashanti region, but the people are not only coming from the Ashanti region.
Yeah.
So they're coming from a neighboring region because Konfanoche is a referral center.
Of course.
You know, so then as the numbers are coming there, the challenge, you will see increases, but they're coming from different places. And a lot of the times, people are coming after long delays. You know, they could have come earlier.
Yeah.
You know, and sometimes it's too late, you
Yeah,
know.
I mean, generally we need to pay attention because we have other referral hospitals in other regions as well. How come we are not recording these from Kolebu? How come you're not? You get it. So
Yeah.
it means that there is a major challenge in the
in terms
Ashanti
of-
region, yes, and neighboring, maybe regions
yeah.
as well.
Yeah.
So we really need to pay attention
Yeah.
to what exactly is causing that, and access to healthcare delivery in some of these areas. Because for me, I still think that pregnancy is not
A disease.
a disease. It's
not.
just
No, it's
taking
not.
care of yourself, just to make sure that you are safe, the baby within you
Yeah,
is
it's
safe.
also
So
safe,
if we are equipping, if we are paying attention, you know, and all the time still also educating the
Yeah.
health
Which
workers,
is, I
you
think,
know,
is critical. The
on
health
exactly the
workers
health
and
workers,
then the mothers.
because they are imparting some
Yeah.
form of knowledge, you know, on the nursing mothers as well, and their sense of professionalism, their sense of urgency, you get it.
Yeah.
So we have cases on our hands, but we get to the hospital and health workers are not treating them as emergencies.
Yeah.
They are not in a hurry because
Yeah,
they probably think that people die anyway.
Yeah,
You know, this is
so
nothing
why
too
are you
serious.
rushing me?
Why are you making
Yeah.
it look like something is seriously happening?
Yeah.
We really need to get
Also
people to
deal
change
with
their
that.
mindset,
Yeah,
you know,
yeah,
and
yeah.
treat every case
Yeah,
as
as an emergency. It's
emergency,
important.
because once the person has been rushed there, it means that, because on a normal day,
Yeah.
pregnancy shouldn't take you to the hospital on admissions and all that.
So if
but
it
there are
is,
people
then
who
it's an
go through this.
emergency.
So if somebody comes in with this, it means it is an emergency, and we really should, you know, treat it as such. And so I think that, because sometimes the hospitals are equipped, you know, there's inadequate medication, facilities are in place, but our own human behavior is what causes all the problems. So I think that we also need to reposition ourselves, change our mindset towards these things, and attach some kind of seriousness, you know, because this is death and life
really-
issues
it's
we
really
are
about
talking
that.
about.
Yeah.
So I think that health workers need to really pay attention, and pregnant women as well. You really need to take good care of yourself and report to the hospital when you identify any abnormality, things that shouldn't be. Just don't take things for granted. Whether it's a chip compound, is a very small clinic in your community, or just seek medical help.
And the fact that your pastor has prayed doesn't mean you shouldn't go to the hospital.
Charlie.
Do you get it? It's important.
Yeah.
Let your pastor pray, it's fine. And I believe in prayer, but also go to
Do the
hospital.
physical
Do the physical
thing.
part too.